Dyskeratosis congenita, or DC, is a rare genetic disorder that reveals how our cells age and divide. At its core, DC is a telomere biology disorder, telomeres being the protective caps at the ends of our chromosomes, much like the tips on shoelaces. In DC, a genetic flaw causes telomeres to shorten much faster than normal, leading to premature cell aging and death. This rapid telomere loss disrupts tissues that need constant renewal, like skin, mouth lining, and especially bone marrow. The result? Cells can't divide properly, and vital systems begin to fail. Studying DC gives scientists crucial insights into aging, cancer, and regenerative medicine. By understanding what goes wrong in DC, researchers learn how to better protect our cells from damage and disease. This rare disorder is a powerful example of how tiny changes in our DNA can have massive effects on health and longevity. The journey to understand DC pushes the boundaries of science and offers hope for new discoveries in medicine. It's a testament to how rare diseases can unlock universal truths about life itself. DC often reveals itself through a classic triad of symptoms. First, nail dystrophy. Nails become thin, brittle, and may even disappear as the nail bed cells age too quickly. Second, a lace-like pattern of dark skin pigmentation, especially on the neck and upper chest, caused by unstable skin cells. Third, white patches in the mouth called oral leukoplakia, which are precancerous and can't be scraped off. These three signs, abnormal nails, mottled skin, and mouth patches, are key clues for doctors. Not everyone with DC has all three, but their presence is highly suggestive of the disorder. They're the visible tip of a much deeper cellular crisis. Early recognition of this triad is crucial for timely diagnosis and intervention. The most dangerous effects of DC are hidden inside the body. Bone marrow failure is the most life-threatening complication, as stem cells with short telomeres can't produce enough blood cells. This leads to severe anemia, infections, and bleeding problems, often the main focus of treatment. DC also brings a high risk of early cancers, especially in the mouth, skin, and blood, due to unstable DNA. Other organs can be affected too, including the lungs, causing pulmonary fibrosis, and the liver, leading to cirrhosis. These complications show how essential telomeres are for the health of every tissue. DC is a complex, multi-system disease that demands careful, ongoing management. Its impact reaches far beyond what's visible on the surface. DC is a genetic disorder with three main inheritance patterns: X-linked recessive, autosomal dominant, and autosomal recessive. X-linked recessive DC mostly affects males passed from carrier mothers. Autosomal dominant DC appears in every generation, while autosomal recessive DC can surprise families with no prior history. Symptoms and severity can vary widely, even within the same family, making diagnosis challenging. Doctors start with a physical exam for the classic triad, then run blood tests to check for bone marrow problems. Measuring telomere length in blood cells is a key diagnostic step. Genetic testing confirms the diagnosis and identifies the specific mutation. Because symptoms can appear at any age, DC is often missed or misdiagnosed for years. Early, accurate diagnosis is vital for effective management and family planning. There's no cure for DC yet, so treatment focuses on managing complications. Bone marrow transplant is the only curative option for marrow failure, but it's risky. Androgen therapy and growth factors can help boost blood cell production for some. Supportive care, transfusions, antibiotics, and cancer screening is essential. A team of specialists works together to monitor and treat the many aspects of DC. Research is advancing, with gene therapy and telomere-protecting drugs on the horizon. Each discovery brings new hope for patients and families. DC reminds us that rare diseases can teach us profound lessons about aging, genetics, and the future of medicine.